Health, and today we're talking particularly about the global health landscape. I'm with David Stuckler. And David, just to show you what we're going to be doing today, and I know you know this already, but I think other people are going to be interested. We're going to look at this global health landscape. I'm going to be walking through this with people. It's kind of quite startling how much there is out there. And the other thing that's quite fun, and we've never done this before, is we've got video footage. We've got actual clips of people that watch us on YouTube and LinkedIn and have sent in questions, and we're going to bring that video footage up, play the video, and then answer their questions. And if you're watching this, can you see this little ding right over there, that QR code? Scan that in with your phone and it'll take you to a web page that'll let you submit video questions. But of course, as usual, if you want to submit questions type in questions either on LinkedIn, Facebook, YouTube, if you just type questions in the comments, they're going to pop on the screen later and we'll answer those questions too. So without further ado, David, how are you today?
Hey, doing great. End of the week. Excited to get started. And for the next installment, I got a lot out of your global health landscape map. I think those of you watching are going to see a complex labyrinth of global health institutions in a new way. And I like many of the people probably watching here, are very visual. So it's a very good tool. I don't want to steal the thunder from it, but stick around. You're not going to want to miss this.
It's a lot of fun. The other thing is I'm going to try and find a way of making that map accessible to people online. I haven't quite figured that out yet, and like kind of watch the space. We're also not going to be able to go through the entire map in just today. So we'll dip into it and we'll bring it back into future episodes. You know what? I'm quite excited about this business of bringing people in, bringing video footage in of people that have sent us video questions. Should we just put one of those on the screen now as a starting point? Because I just can't wait to do it. I'm so excited. Should we just pop? Let's do it. Okay, here we go. Hope this works. There we go.
Hi, my name is Ishita Ghag. I'm from India. I firstly want to thank you for this opportunity. This is a great way of interacting. A little bit about myself. I recently graduated from a university in UK and I got my master's in global public health. I am right now working as a research associate in a developmental pediatric hospital in India. I want to know more about how I can move away from the research field and into public health consulting. I feel that I am a greater fit for the roles, but I'm not sure where to start. I'm actually very confused about how to go about this. So it would be really great if you could help me out. Thank you.
Okay, so that's a good question, and it's a common question. I mean, David, you and I have been asked that question 1,000 times by people, and I think it's a great question. So we're going to jump into that, but just so that people know, you can scan in the QR code over there and send us your questions, just like that one. David, your initial thoughts.
Initial thoughts and reactions. So currently working as a research associate in a pediatric hospital, has a public health background. So obviously enjoys research, but wants to move into consulting.
Yeah.
But in a way makes it sound like this is going to completely changing streams or tracks. And a lot of consulting really taps heavily into the tools of research, really privileges the quantitative or qualitative abilities that you can bring to the table. So if you think about this is kind of it can be a logical next step and continuation of what you're already doing. So first thing I often recommend in this is make sure you're really doing well what you're doing now. And if you're doing some research, try to get yourself in the vault yourself into the pole position, publish some papers, because that's going to be a feather in your cap. It's going to show kind of the quality that you're capable of bringing to a consulting company. And then already see if you can get your foot in the door, make a map. In this global health landscape map we're about to present has a great map that's going to clue you into, here's where some of the consulting opportunities are, and that I can begin to go for. So that's just kind of a start. This is obviously a more detailed question. Greg, what are your thoughts there?
Yeah, I had the same thoughts. I mean, here we've got somebody who's clearly got research skills and is wanting to make a little bit of a change. So I agree with you. Bring those skills into the conversation. Present yourself as somebody that's got a background in research. She's obviously got an ability to, and we shouldn't get into the details of what kind of research that she does, but nevertheless, that's useful. In terms of what she should do next, firstly, I always tell people network like crazy. So use things like LinkedIn. Reach out to people where there's an overlapping interest. when I say to people network, here's my like in a nutshell advice about networking. If you find somebody that you do not know, it might be on LinkedIn, it might be through another network, and you sort of think this might be a useful person for me to reach out to, no problem with that. People reach out to me all the time. Nobody minds. What people do mind is if you send them like a 3-page long email that's got your CV attached to it and a line at the end like, do they have a job for you? Especially if it's a senior person and they're busy and they're probably getting a lot of correspondence, they're going to struggle to find the time to be reading through all of that. And I actually think you're kind of going to doing yourself a disfavor and you might just annoy people. I think here's my little trick. If you find somebody that you really want to kind of connect with professionally, send them a short message that includes a question, right? So it's literally a couple of lines that includes an insightful question. Give them something to answer. Don't make it a question that's kind of like a little bit too difficult to answer because, like what's the meaning of life in the universe? Don't do that. A good idea, here's a good idea. If they've published a paper, read their paper. Send them a message saying, I read your paper on X. I found it interesting and I have a question. They will be complimented that you read their paper. They'll be impressed that you've now demonstrated some insight into the work that they're doing. And I would be very surprised if you didn't get an answer. And once you've got an answer, boom shakalaka, your network has now expanded. This is somebody that you've now developed a sort of, even though, tangential professional relationship with. I wouldn't follow that up with annoying them with more questions. I'd kind of leave that for a while, reach out to them again a little while later. And you might say, I just wanted to let you know, I'm working as an independent consultant at the moment. And if you need any help with any of your research or any of the work that you're doing, I'm available. So it's not saying give me a job. It's just saying I'm available, and if you would like my CV, I'd be happy to send it on. And I think that's a very polite, systematic, sensible way of expanding your research in that kind of professional environment. I mean, David, if somebody reached out to you and had read one of your papers and asked a question, are you going to answer?
Definitely. There's a gentle flatter there that a lot of professors and people, even in more senior positions, will respond to that gentle flatter if you don't do it in an obnoxious way. I have a graveyard of emails of students trying to contact me, banging me over the head. Here's my CV. Pay attention to me. But you really almost need to reverse the nouns and not think about just yourself, but think about, well, was this person I'm trying to reach interested in, and try to form a mutually beneficial relationship based on reciprocity. One thing we were talking about just came to the back of my mind, Greg, as before the show we were talking about some cultural differences, and I find some of the Americans, like myself, tend to be quite confident and bold, and others, to an extent, are maybe a little bit more reserved in taking that approach. What would you say to some of those who are a little bit more introverted per se, perhaps, in unleashing their ability to go reach out to people like that, because it can feel some people are very nervous about it.
I'd say it's true. It might not come naturally to people to reach out and be kind of, confident and brave and sort of put yourself out there. And I think once you've done it once or twice, it gets easier. And I think everybody's done this. Everyone that's working in the global health space, in the professional environment, at some point has reached out to somebody for advice, or and the first time it might feel a little bit awkward, but it really gets easier. And especially when you get a response or reply that's really friendly and polite and professional, and people, you just need to get one or two kind of positive replies, and you'll feel much better about doing it. So, but I think definitely if you reach out to people, if you do it in a courteous way, keep the email short. I can't emphasize that enough. Just keep it short. And include a question, you're going to get an answer, I'd say, most of the time, and that's a good way in.
I think it would be helpful, Greg, perhaps in the future, to even show for us to think about, show some examples of those approaches, the good, the bad, and the ugly, and I could maybe dig into my graveyard of, hey, don't do this, to share with folks. But I missed the name of the person who submitted, but really, thanks for asking that question. That's just, when you send a question like that, that's helpful not just to you, but the entire community. So you're really doing a great service to everybody participating. So thank you.
Other people watching will have had the same question. So thanks very much for that question, and keep the questions coming. One more thing on the looking for consulting work, you could also, like, when we look at the global health landscape, which we're going to do in a minute, you can find organizations where there's an overlap with your skill set and interest. On their web pages, you can often find an email address and you could send your CV and say, I'm available to be a consultant. But when you do that, I would be as researched as possible. So do your due diligence. So if you're looking at an organization like Unitaid, understand what it is that they do, what their raison d'etre, their mission, their vision, projects that they're working on, and send an email with like real specifics, sort of saying, look, I know and understand your organization works in this particular area. I've got background in that space. And if you're needing some help with a project, I'm available and here's my CV. And that doesn't take that long to do. To do the research, and to send an email like that doesn't take long. You may need to send a few, and you might get lucky and get a reply. There's also websites that you can filter jobs that are being advertised by consulting work. So the WHO is a good example. On the WHO website, when you go to the job section, and we'll show that again. We often go to that website on this show, and we'll do it again. I don't think we're going to have time to do it today, but you can filter. There's a little filter by consulting work, and you can look for jobs that are really specifically overlap with your interest.
Just on consulting, I just searched through. Often there's two flavors of consulting. You could go work for a consulting company. You could do consulting for specific NGOs and organizations. And as it happens, with members of my team, I was just scanning through the UNGM website. You just Google UNGM, you'll find it. And there's also a consolidated list there. And I know, Greg, you've got another platform where you've consolidated some of these lists that take the guesswork out of the research and will save you a bunch of time. So you're not going to want to miss that from Greg.
Yeah, so let me just quickly, with that question in mind, let's have a look at what I've got here is the big headings that global organizations working in the global health space. There's other ways of configuring this, but this is the way I think about it. These aren't in any particular order. In fact, I think this software sticks them into alphabetical order, so we just have to live with that. But the big headings here are academic and research, funding agencies, government departments and state agencies, multilateral, bilateral, and global agencies. That's going to be like the WHO, the World Bank, et cetera, NGOs, partnerships, and the private sector. Now, what I might do, and I'll do this really quickly, we're not going to have time to talk about all the organizations, because within each of these headings, I've got lists, right? So what I might do is I might whip through this, and so that people watching this can come back to the video and play the video slowly and push stop and look more carefully at the lists that I've created. It's not a comprehensive list. This was stuff that, just organizations that I'm conscious of, that I'm aware of, that I sort of know and understand, and many of them I've worked with or for in some shape or form. But I just want to go through these different headings. And what's interesting here, and David, while I'm going through this, you might want to just talk about the fact that in academia and research, you're not just talking about universities. There are these collaborative research organizations like DNDi. They do, research into drugs for neglected tropical diseases, for example. That's not a university, but they've got a strong research component. The WHO collaborating centers as well. You've got public health research institutes, again, not universities. A lot of them are doing M&E work, monitoring and evaluation. We've got think tanks and policy research organizations like Chatham House. These aren't all, like Chatham House is certainly not necessarily just global health. It does other stuff, but some of the work that they do does overlap with global health. But some of these are very specifically about global health. And then, of course, I've got a list, and I just popped a few down. Obviously, there's hundreds of universities working in academia and research. Any thoughts from yourself, David, about academia, research, that side of things?
Yeah, I think for somebody, especially if you're just open up and saying, I want to do consulting, this as a whole, stepping back for a second, Greg, is very helpful to map out the landscape, because there's so many different points of departure. I think some of the very exciting work is happening in some of these hybrid UN academic organizations that UN institutions might be behemoths and a bit slow moving bureaucracies, where the collaborating centers and these different think tanks that kind of are consortia of these different groups that cut across NGOs, funding agencies, state departments, multilateral organizations are really quite exciting. So I think that top space is actually a center for research where a lot of innovation is happening. And the most prime example I think you see is the Institute of Health Metrics that played a very critical role in the global burden of disease, continues to, and
Yeah,
even had a
yeah,
nice dynamic interaction with some of the UN organizations, pushing them to up their game and
yeah,
do
yeah.
better. There's a lot more to say there, but definitely a great place to look and check out, and not your ticket to a boring career.
Okay, I'm just going to open up some of these so that people can come back to the video and have a look at these lists in their own time. Here we've got philanthropic organizations like the Gates Foundation, and then multilateral funding agencies like the Global Fund for AIDS, TB, and Malaria. Government departments. Now, this is where I work, right? So you've got obviously departments of health, and these are in different countries. But you've also got your local and regional health authorities. Now, I work for well, actually, I work for a state agency. I work for the Health Service Executive. But you've got more sort of local and regional authorities down there. Let's just close this down. We've got NGOs, multilateral, bilateral. This is the list of the WHO, the ILO, the PAHA, UNAIDS, UNICEF, et cetera. You can have a look at that list in your own time. Those are the sort of big multilateral organizations. Under NGOs, there's humanitarian NGOs. So these are the guys that'll fly in and actually provide relief, humanitarian relief on the ground. Then there's international NGOs, and these guys are kind of working across countries. They also have presence in countries, but they're not really sort of humanitarian relief. And then there's national and local NGOs that are actually within countries that aren't coming from another country. They're not bilateral or multilateral. They're just the NGOs in specific countries. Partnerships are interesting. So these are often public-private partnerships, and they can be disease-specific, they can be focused on global health, or they can be for drug development. And these are really interesting. There's an element of the private sector working with public sector organizations to do things that either side of that relationship would find difficult to do on their own. So, for example, a lot of these, the malaria vaccine initiative, Stop TB, et cetera, will be focused on the private sector will be bringing sometimes drug development, and there's more of those down at the bottom, know-how to an environment where these partnerships, or the sort of the public sector side of them, will have a better understanding of the need and the demand and what's out there, and be in a position to create the demand for the product. So it's a win-win situation. There's obviously, everybody knows Gavi, and then there's some of these really interesting partnerships for drug development, like DNDi, and that's popped up again, TB Alliance, et cetera. So those are the partnerships. And then at the bottom, we've got, these are consulting companies, so, don't discount that as a place that you might want to work. There's corporate social responsibility initiatives, often very interesting. And I've worked with people that have been in that space, which is interesting. And then, of course, you might consider working for big pharma. And there's nothing wrong with that if that's something that you'd like to do. So I'm going to try and make this map available to people. I haven't quite figured out how to do that just yet. But hopefully I'll have this, in one of these episodes, I'll talk to people and say, this is how you can access this map. And I will flesh it out more than it is at the moment.
I've never seen it laid out so clearly, Greg. Just to say, I want to use this in the courses I teach on global health to paint the landscape, because it's bewildering and difficult to navigate. So very cool. And I can see some questions in the comments about
yeah, and I'll just pull up the comments now.
Yeah, there we go.
Somebody said, will we be able to print out this list? So the short answer is, I'm going to find a way of getting this list to you. And within each of these nodes, I'm also going to have additional notes and information that you'll be able to access. So I'm just trying to find a way of making this kind of shareable. At the moment, I think in terms of the license that I have for the software, I can't share it, but I think I can revisit that. So watch this space, and hopefully we'll have something that's a bit more shareable quite soon. Should we bring one of those other questions? We've got another video question.
Yeah, let's do it.
The question is that, can you provide us, like students or recent graduates, with some kind of research so that we can be a part in voluntary capacity, where we can actively participate in that and put our theoretically what we have learned into real world use and get as much of experience out of it. um, Thank you for giving this opportunity to represent myself. Thank you.
Okay, well, thanks very much for that question. And David, if I understood the question correctly, he was suggesting that he was looking for ways of getting in, like basically working as a volunteer
Yeah.
to get that early experience in the global health and public health space.
It goes back to what you were responding earlier to the question about transitioning to consulting. When you have research skills and you can communicate those, you're valuable to a lot of organizations who are bootstrapped, especially NGOs who are looking for support and they don't have the capacity. A lot of people want to go straight to WHO and say, I want an internship with WHO, but don't forget about some of these other institutions that will really put your talent to good use. So if as I'm understanding, there's two things. If you do have the research skills already and just want to apply them, then I would consider reaching out to some of these NGOs who are hungry for somebody who says, hey, I've got a laptop, I can volunteer, I can work for free, and I can help you analyze data, I can help you collect data, and they're hungry for that. If what you're looking is more the kind of the apprentice side of mentorship, which it really is a bit of an apprenticeship system, it's the same approach that Greg mentioned earlier. I'm just going to do a shameless self-advertising plug. If you're looking to boost some of your skills, we have a 100% free step-by-step systematic review course, which is what I recommend for really getting your feet wet into research for the first time, develop confidence, mastery fast, as well as good habits that will carry you throughout your research career. But yeah, what are your thoughts there, Greg?
Yeah, I agree with everything you've said. And I think what's quite interesting about the world that we live in now, which is different from back in the day when I was breaking into the global health space, and that is that you can volunteer and provide assistance to organizations online from wherever you are. So that particular question came from India. And my first thought was, I kind of thought back to, like 30 years ago when I was doing an internship and I was thinking, it's quite difficult and expensive to like pick up your life, move somewhere, live in sometimes a very expensive city. For example, I did an internship at the WHO in about 2003-ish. And at that stage, they didn't give you any financial assistance. I believe they do now. And Geneva is a very expensive city to live in. And the expectation was that you would stay for 6 months. So it was, but that's all gone away now. Firstly, a lot of these organizations have acknowledged the fact that if they take on an intern, they need to provide assistance where needed. Secondly, I think, especially when you're talking about volunteering, the fact is that you can do this from anywhere. And we've got Teams and Zoom and all these sorts of things at the moment. So what I think a thing to do, and this fellow, as he mentioned, he's got research experience, he could reach out to almost any organization in this sort of wider network and offer to do volunteer work and be available online. And in his shoes, I would make very specific offerings. So I'd be saying, I can do a systematic literature review for you if you want, or I can do some data analysis for you if there's a need. And it might be the case that in the first instance, it's some of the sort of smaller nonprofits that kind of jump at that because they're often looking for help. Breaking into the sort of WHO or the World Bank, et cetera, is a slightly more complicated ask, and that may come as a function of you gaining experience and building your network, and then suddenly opportunities to kind of do that work will emerge. And very often it is off the back of volunteering that you might get that opportunity to do some consulting work. And then it's often consulting work that then translates into actual work, like a paid job, with a pensionable job, et cetera, et cetera. So I empathize with the struggle. It's not always easy, but definitely reach out to organizations and to people, make the offer, and see what sticks.
For example, right now, Greg, I mean, Africa is getting hit with a monkeypox outbreak, and I think sometimes whenever there's some kind of humanitarian crisis unfolding, it tugs on our heartstrings. We want to help in some way, and some people try to do so through donations. I like to try to do so through volunteering. So if you have some skills that can help some resource-deprived communities, you know how to do GIS mapping, for example. There are institutions that are really hungry for those skills. But yeah, Greg, I'm really glad that you flagged this because I don't think there's a clear infrastructure where people, again, just there's almost an inertia. They just don't know how to get started. So it almost, I wonder, Greg, if we think about even a step-by-step guide to getting started and just make it easier for people.
Actually, that's quite a nice idea. I like it a lot. Just to paint by numbers, these are
Yeah.
sort of practical things that you can do to make yourself attractive to organizations in terms of, in the first instance, volunteer work, but then also consulting work and jobs, et cetera, et cetera. And I think we could even build into that, like things like what your CV should look like. One of the things that I've noticed is when I receive CVs, sometimes for people that are looking for positions, sometimes they are pages and pages and pages long. Something I'm conscious of is that, like, you apply for a job and sometimes there are hundreds of candidates. I know when the WHO advertises a job, there are hundreds of candidates for every single job. And if you can imagine that there's some hiring manager looking at hundreds of CVs, if each CV is 10, 15 pages long, it's not getting read. It's just not. Nobody has that level of sort of patience and like. I think a CV should be short and punchy, and then maybe some details kind of attached as amendments or appendixes to that. In my view, like try and keep it short. We can actually make one of these sessions about CVs, and I'd be happy to stick my CV on the screen and get feedback and thoughts, criticisms, pontifications, etc., happily. David, you brought up monkeypox, and I actually wanted to ask you about that because we were talking about it just before the show started, and you had some interesting insights. And I think on these shows, we should be talking about what's happening in the global health landscape. So could you just tell all of us what you were saying to me just before we went live?
Just briefly, there's been a lot of concerns in the aftermath of COVID that the pandemic was not handled as well as it could have been, and numerous postmortems done to try to figure out how to do better. Well, we have another epidemic unfolding in Africa. There are monkeypox in Europe, other places as well, but it's one of the centers at the moment, and some of those lessons post-COVID are being learned. And one of the challenges post-COVID was developing and mounting coordinated responses where action was met with coordinated funding as well to power it. And this time, WHO has done a coordinated funding round in which multiple African countries have joined up and participated together and are mounting a much more coherent response than ever before. It's a definite departure from past trends. There's a lot more to say about it. But it's an exciting chapter in pandemic management and global health learning from past successes and failures.
It's good to see, because I know sort of post COVID-19, I've been very involved with a lot of the sort of planning for future pandemics, and it's quite remarkable how much energy and thought and time is being spent getting individual countries, but also sort of working across countries, getting everybody ready for. Look, there's a lot of anxiety around avian influenza, and rightly so. It is a worrying. Monkeypox is worrying too, and for a number of reasons. Firstly, obviously, we're seeing it emerging in Africa at the moment. The difference between what we're seeing now in terms of monkeypox and what we've seen historically is there's definitely a shift in terms of the mortality rate, substantial shift, and so the sort of the concern is that what we're seeing at the moment is going to affect it's a more severe disease, and that is worrying. And hopefully we can put a lid on this quickly.
Yeah. Again, similarly, Greg, back to Ebola. Again, the cliche in global health, which is really true, is that these diseases don't respect borders, but our responses do, unfortunately. And this getting this coherence and coordination across a group of countries, no small feat. Really, anyway, stay tuned on this. Even if you don't have a direct interest, I think anybody who's interested in global health, it's just important to pay attention, not just to the epidemiology, like Greg's citing, and how quickly things can evolve, but also our responses.
It's amazing how much of public health, and this again goes to the skill sets that we should develop. If you're interested in public health, obviously not everybody can be skilled in everything, but if you're this way inclined, let me just tell you that there's a need for people that understand how to get stuff to the right people at the right time. And that's a big part of the global health landscape, is, procurement and doing pooled procurement across different countries, demand forecasting, which involves like really know how to work with numbers, how to figure out what's going to be needed when. Then, the actual contracting, shipping, warehousing, distribution, inventory management, rational use of drugs and products. All of these things come to play. And people that know and understand the nuts and bolts around that are extremely useful. It's this, and it's a pity because it's the sort of content that's not really leaned into in an MPH. So I worked in that space a little bit, and I had to kind of like get myself up to speed on it. And sometimes really what it means is these organizations hire from the private sector. And so when I was working at Chai, like there were all sorts of people there that were from all over the shop, there to kind of help get some of these nuts and bolts of getting things done over the line. David, I'm going to suggest, like, I would like to, if possible, keep these live streams reasonably short and punchy. Is there anything else burning that you want to raise? I don't see any new questions popping up in the chat. If anybody's got a last,
I'd like giving people a quick opportunity if they have some burning questions in the comments to drop them in. I can see one from Victor. What about TICs? But I'm admittedly dense. I don't know. But just give people that quick chance.
Okay.
And while we just reflect for a second on the future of this podcast together, Greg, because we're really listening to you. And we've responded to you with the video questions, which we absolutely love.
Yeah,
it's a collective space for mutual benefit. And like all communities, you get a bit what you put in. So if you are interested in joining us and even participating actively, or you have topics that you'd like to see us cover, drop that into our video questions. We listen to everything and take very seriously anything that you send us. So we're a part of how I see our role, Greg, here is also here to support our collective audience.
Yeah, absolutely. And look, if you use this little QR code that's on the screen at the moment, it doesn't have to be a question. You might want to just send in a quick video. And can I ask people, just make it short, like send in something that's 30 seconds, right? Because it's easier. If it's too long, we're going to have to chop it up a little bit anyway. So send stuff that's short and punchy. But it might be, hey guys, I'm working at this organization at the moment and I love it. It's been a great experience, and I really, and just wanted to share that with people. It's a good organization to work for, highly recommended. That sort of thing I think is great, because people then will, it'll make them sort of think, hey, why don't I go and look at that? Or maybe you're aware of a job opportunity in the organization that you work, and you want to just send a little video clip saying, hey guys, we're looking for, a communications officer or a logistics person or an epidemiologist or a statistician, or we're looking for a lit review to be done and we're looking for a consultant, whatever. Or just like, hey guys, I'm working in this country and it's a sunny day and love public health, double thumbs up, high five, boom shakalaka. Send us anything. We can't promise to use everything, but we'll just send it and we'll see what we can use.
We've got one here, Greg, from Morgan Jones.
I'll bring that up on the screen.
Yeah.
15 years in federal government, admin work, master's in public administration, and starting a master's program to obtain certification in public health. What's a great skill to focus on? Good question. That's a lovely question. I have what I think is I think anybody reading that question will have a slightly different answer. So will I jump in with what I think is a nice answer to that question?
Yeah.
I mean, David, you may have a slightly different take on this. Firstly, you're already bringing a skill set to the table. So double thumbs up. Seriously, you're going to be a valuable asset in the public health space, given your experience. If you layer on top of that a solid understanding of epidemiology, that's going to be a huge stepping stone to applying your existing skill sets. You've got a skill set in how to get stuff done. Layer how to get stuff done on top of epidemiology, and you're really talking about public health. Because epidemiology is understanding the nature and the distribution of disease, both in terms of time, place, and person, and the causative relationships between exposures and outcomes. And those causative, the exposures also have, a temporal and geographic distribution. And if you understand all of that, almost all public health problems fit somewhere within that mess. And it's the starting point of most public health issues is the epi. who's sick or who's at risk, and how at risk are they. If you get that right, you can start stapling stuff on top of it. But that's just one answer of many ways to cut this up. David, do you have any thoughts on that?
Yeah, I agree. I mean, this is an opportunity to invest in yourself, and it's a gift that you're giving yourself at this protected time to get this certification. There's going to be some built-in training with your course, but if you are allocating this time and energy, I would definitely not shy away from picking up the skills that maybe you felt would be helpful, but were too scared to ask about in your professional context. So that could be picking up those quantitative skills that do take a dedicated time investment to get up to speed with, such as it could be learning R or data analysis, so that maybe you're not going to do it yourself, but you can feel more confident commanding teams later on that do use it. I'm in general, I'm a bit biased here, but I do see in policy that the quantification is a universal language of policymakers for understanding impacts, environmental, health, economic. So I strongly would advocate the epidemiology, yes, and with that, developing a strong quantitative foundation so you can feel confident whatever policy circle that you're in when the numbers do come up. Great question.
Yeah, great question. There's a couple of questions coming in now, and let's just keep things going while we can. Is it true that global health funding is reducing? Is this affecting the landscape? You know, I've not seen the numbers, so I don't know if, and it's probably a difficult. There might not be a very clean answer to that question, because global health funding is something that happens in multiple little bits and pieces and shapes. There's funding for research, there's private sector funding, there's funding within countries, there's bilateral and multilateral funding. It's probably the case that what is being funded is shifting. So there's been in recent years a huge shift toward pandemic preparedness. In actual fact, and in that space, you would probably argue that, you know, if you looked at aggregately how much money has gone into pandemic prep, that it probably global health funding has increased, but it's been very, very, very focused on what has the attention of policymakers. And there's certainly other areas which I think are massively underfunded. Mental health problems, like mental health and psychiatric illness is quickly becoming, if it's not already, the greatest contributor to the global burden of disease. But it's very difficult to count. It's very difficult to have a nice KPI that's stapled to your interventions. So funders don't like to give money. They like to give money to things where they can say, okay, we've treated 10 cases of TB for this amount of money, big tick. When you're treating people with mental illness or you're doing work that prevents mental illness, it's very difficult to say for sure what it is that you got for your money, and so the money tends not to come at all. And there's lots of spaces where the funding, I think, we're massively underfunded. There's other areas where buckets of money have been poured in, perhaps appropriately. So I think pandemic prep is important. I think antimicrobial resistance is a space where more money is needed to really kind of get on top of that, because we're not doing well in that space. I think more money is needed in the climate change and health space. You know, I know it's a hot topic, but there's not huge buckets of money going into that necessarily. So I don't know. David, do you have any sense of that?
A few quick points. The aggregate data, unfortunately, are a bit out of date. It's not like the stock market where we've got up to the millisecond information, especially on donor. There's the donor contribution and then what actually is dispersed from the donors. They don't always align. But definitely what we do know is it hit around record highs during COVID. So if there has been some drop, it can be partially a rebound to normal levels after that. But I'm glad Greg brought up this idea of neglect. I mean, some of the early papers I did as a grad student published in Lancet were showing that where global health funding is going to really misaligns with the burden of disease measured by DALYs or even mortality. And it's clear that the motivations for investing from people who hold the global health purse strings are not necessarily about what is optimal for global health, and has more to do with donor incentives and priorities. So mental health is one that's commonly viewed as a neglected area. But yeah, we could do a whole session on that, but I think it's hard to give a clear trend, at least right now for the last few years, of the aggregate sum of global health funding.
And what I might do is,
Sorry, yeah,
I
go
might
ahead.
try and get some information on that, and maybe one day we do a live stream where we focus on what's happening in the funding space. Like
Yeah.
where's the money going, who's spending what, and actually make it a point of discussion. We didn't come to this particular session necessarily prepared for that, but I think it's a great question, and it'll be interesting. And then I just put Asiba, I don't know if I'm saying your name right, but you said hello.
Hey,
Greetings from
Steve.
Guinea. Hi, great to have you with us. And then I wanted to pop this question up.
There's one from one of my subs. Yeah, down later. I wanted to ask from Susan if we can get that, but let's take Victor's
Okay,
here.
we'll get Susan up. But this is, I just wanted to say to Victor, like double thumbs up, boom shakalaka. Working with
Yeah.
AI in public health with the team on waiting lists for children and adolescents to access mental health services. Like I can't tell you
Very
how
cool.
excited I am to read that. My day job at the moment involves very much trying to improve access to mental health services. I was in a meeting this week about how we can use AI here in Ireland more effectively. I'd be really interested to understand what you guys are doing in Uruguay. So Victor, please reach out to me outside of this, and I'd love to hear more about what you're doing. That's really exciting.
Greg, to book on that, if you're doing something that you think is super cool in global health and you want the whole world to know about it, send us a video.
Send us a video, Victor.
Check it
Send
out.
a
We
video.
want to
We
know
want to
about
hear
these
more about that.
pockets. I love these pockets of micro innovation
Yeah,
that we
I love
wouldn't
it.
hear from without this platform. So thank you, Victor. Yeah, send it to us.
I'm desperate to know more about what he's doing there. So definitely tell us about that. And I'm just the other questions that have come in, and I just hope I haven't missed one.
If you could scroll down to that one from Susan for me, because it was one that I think a lot of people are interested in. I don't know if you're able to scroll down to it.
I can't see one from Susan, but hang on.
Okay.
Let me just see what I can find. Sorry, I will keep looking for the one from Susan.
Okay. Don't worry. But let's take this one here from Cass99. So Cass says, I work in SRHR in Uganda and have noticed funding, I'm just dodging my camera here, shift to climate initiatives. So is there a need to find ways to incorporate this into the programs and also look into alternative means of funding?
Interesting. You know, Cass, the idea of looking into alternative means of funding is an interesting idea. I worked for Unitate for a while, which was considered to be sort of an innovative funding mechanism, and it was, and so I got interested in this idea of innovative funding. And the way Unitate is funded is they have an arrangement with airlines with particular countries, any ticket that's bought, I think $1 gets put aside and goes into Unitate funding. So it was a really interesting way of raising money and a very effective way. So looking for alternative means of funding, I think, is interesting, and people should be thinking along those lines. It should be on the table. A shift towards climate initiatives, okay, that's interesting. I think it's probably a good thing because climate is a serious problem. My concern is that what is being left behind? So is money being taken away from something to fund climate initiatives? What is it that's now not being funded? Should we be concerned? Do we need to worry? So I think that's an important part of the conversation, Cass. Thanks for raising that. And feel free to send us some more details. There's a little video clip. We'll put it on the show and talk about that. Let's just see. I'm looking for a question from a Susan, and I can't seem to see one.
Right.
Sorry.
Well, let's keep going with these.
Do you remember what the question was, David? And you can just jump in and talk about it.
It was effectively saying, I think this has to do with how the messages are streaming and harmonizing in from both of our channels. But she was saying she was unaware that there were so many consulting opportunities available in global health. And again, asking, with a research background, and part of it cut off, so I didn't catch all of it, but asking how to break in. I'm going to look here on my channel and see if I can find the full verbatim question. But again, was along that theme of that I think a lot of people are wondering about. Here, I've got from mine. So, had no idea there were so many consulting opportunities. How would you become a consultant without consulting experience?
Yeah. And that's such a common question because it doesn't just apply to consultants, but it often applies to people looking for that first job, and the job requirements are often that you've got experience, and it's sort of the chicken and egg problem. I think sometimes you need to just put yourself out there as a volunteer. But also, consulting work is a little different, because when people apply for a job, there's a terms of reference of the job. They put an advert out there and they put requirements, and they say, we want somebody that's got 2 years experience, 5 years experience. They don't necessarily, I've never seen, and I might be wrong about this, but I haven't seen consulting work being asked for in that way. They're looking for something to be done. They're wanting a skill set. And if you've got the skills, actually, consulting might be the one space in which you can kind of muscle your way in there without 2 years, 5 years experience. If you can say, I can do that work. I'm from that space. You might have done a master's degree and you did your thesis on a particular issue. You know and understand that space very well. You know the details, and you can speak to it. Put yourself out there, and don't sell yourself short. If you've got expertise and a knowledge set, say it. And it won't matter too much that you haven't got consulting experience, I think. But it's a good question, and it's not an easy one necessarily.
You've got this one from Milan, and then Siba asked a substantive one after. I thought would be nice to take.
Right, and I think Milan was just sort of saying that Milan would love to see more on this global health funding issue. I think that's great. We will do that. Siba, regional COVID-19 advisor at RTI. Hi, good to have you with us with USAID funding. Hooray! How could we overcome some vaccine hesitancy in middle-income countries? That is such an important question. It's such an important question. I don't even know where to start. And to be honest, vaccine hesitancy is such. Can I just say this? Let's not try and answer the question here and now, because I think it's such a big topic, and we won't give it justice. We will carve out some dedicated time to talk about vaccine hesitancy and misinformation, and it really is such an important, and you've got people, you've got very high profile, personalities out there, in parentheses.
Heidi Larson on, or some others who have really done great stuff in this space.
So
we've done some work personally in this area as well. See, but if you want to reach out to me, I can share some nuggets on what we've done with WHO on this topic, and some insights emerging from systematic reviews. But yeah, Greg, I think maybe we want to do some programs based on these themes. Again, you sent us these questions. That helps us kind of create the content that's going to best serve you and your interests. So
all of these are great suggestions, and a lovely thing to do is make a short 20 to 30 second video, send it in via the link that we've got on the screen up over there right now, and we'll try and bring that into the conversation. I think that's probably it in terms of questions that are popping onto the screen. I don't know if you can hear my kid.
I think that's the time for us to sum out. Family beckons.
It's time. Listen, it's been great chatting to you, David, as always. Thanks, everyone, for tuning in. Thanks for the questions. Thanks for the video questions. We're going to try and do this regularly, Friday afternoons. Sometimes David and myself are busy and we can't, but as often as possible. I love doing this. It's a great way to end the week. So we're signing off. Thanks for watching. Boom,